Discuss the primary mechanisms by which bacteria develop resistance to beta-lactam antibiotics. Include specific examples of bacteria that exhibit these mechanisms. Answer: beta-lactam antibiotics, including penicillins and cephalosporins, target the bacterial cell wall by inhibiting transpeptidation enzymes involved in peptidoglycan synthesis. Bacteria can develop resistance through several mechanisms. Production of beta-lactamases. Many bacteria produce enzymes called beta-lactamases that hydrolyze the beta-lactam ring, rendering the antibiotic ineffective. For instance, Escherichia coli and Staphylococcus aureus can produce extended-spectrum beta-lactamases (ESPLs), which confer resistance to a range of beta-lactams. Alteration of target penicillin-binding proteins (PBPA). Bacteria can modify PBPS through genetic mutations, reducing the binding affinity of beta-lactams. For example, Streptococcus pneumoniae can acquire mutations in its PBP genes leading to penicillin resistance. Efflux pumps. Some gram-negative bacteria possess efflux pumps that actively transport beta-lactam antibiotics out of the cell, decreasing the drug's intracellular concentration. Pseudomonas aeruginosa is a notable example of a bacterium that utilizes efflux pumps to confer mold-to-drug resistance. Decreased permeability. Changes in the outer membrane porins of gram-negative bacteria can limit the entry of beta-lactams. For example, loss of the opid porin in Pseudomonas aeruginosa can lead to resistance to imipenem. Understanding these mechanisms is crucial for developing strategies to combat antibiotic resistance and tailoring appropriate antibiotic therapy. Explain the key stages of the viral replication cycle and the implications of each stage on antiviral therapy development. Answer: the viral replication cycle consists of several stages, each with specific implications for antiviral therapy. Attachment: the virus binds to specific receptors on the host cell surface. Antivirals may target viral attachment proteins or block receptor interactions, such as Marovirus, which inhibits ECR-tropic HIV strains. Entry: the virus enters the host cell through endocytosis or membrane fusion. Antiviral strategies such as fusion inhibitors, e.g. Infuvitide for HIV, can prevent this stage. Uncoating: the viral capsid is removed, releasing the viral genome into the host cell's cytoplasm. This stage is a target for capsid inhibitors, which disrupt the uncoating process. Replication: the viral genome is replicated using host cell machinery. Nucleotide analogues like acyclovir for herpes viruses inhibit viral DNA synthesis during this phase. Assembly: new viral particles are assembled within the host cell. Protease inhibitors, e.g. saconavir for HIV, disrupt the cleavage of viral polyproteins necessary for mature particle formation. Release: new virions are released from the host cell through lysis or budding. Neuraminidase inhibitors, e.g. oseltamivir for influenza, block the release of new virions. Compare and contrast innate and adaptive immunity, focusing on their mechanisms, cells involved, and response time. Provide examples of how both systems interact during an infection. Answer: innate and adaptive immunity are two fundamental components of the immune system, each with distinct characteristics. Mechanisms: innate immunity, the first line of defense, providing a rapid but non-specific response to pathogens. It includes physical barriers, skin, mucous membranes, chemical barriers, secretions like lysozyme, and cellular components, phagocytes, natural killer cells. Adaptive immunity, a delayed but highly specific response to pathogens involving the activation of lymphocytes, B and T cells, that recognize specific antigens. It leads to the formation of memory cells, allowing for a quicker response upon re-exposure. Cells involved. Innate immunity. Key players include neutrophils, macrophages, dendritic cells, and natural killer cells. These cells recognize pathogens through pattern recognition receptor and initiate inflammatory responses. Adaptive immunity. B cells, which produce antibodies, and T cells, which help orchestrate the immune response, are central to adaptive immunity. T cells can further differentiate into cytotoxic T cells, CD, or helper T cells, CD, each playing a distinct role in immune response. Response time. Innate immunity. Response within minutes to hours of infection, providing immediate defense. Adaptive immunity takes days to weeks to mount an effective response, as it requires antigen presentation and clonal selection of specific lymphocytes. Interaction example: upon infection, innate immune cells recognize and phagocytose pathogens, releasing cytokines that attract adaptive immune cells. Dendritic cells present antigens to T cells, activating them, which in turn stimulate B cells to produce antibodies. This coordinated response highlights the interdependence of both immune systems in effectively combating infections. Mr. Thompson, a 65-year-old man, is admitted to the hospital with pneumonia. His medical history includes chronic obstructive pulmonary disease, COPD, and he is a smoker. The infection control team is concerned about the risk of healthcare-associated pneumonia. What measures should the hospital implement to minimize the risk of pneumonia in Mr. Thompson, and how do vaccination strategies play a role in infection control? Answer: to minimize the risk of pneumonia, particularly healthcare-associated pneumonia, the hospital should implement several infection control measures. Hand hygiene. Strict adherence to hand hygiene protocols among healthcare workers is essential. Alcohol-based hand sanitizers should be used before and after patient contact. Use of personal protective equipment (PPE). Appropriate PPE, including masks and gowns, should be used, especially in areas where patients are at higher risk for respiratory infections. Ventilation and airflow. Ensuring proper ventilation in patient areas can help reduce airborne pathogens. Negative pressure rooms may be used for patients with known or suspected airborne infections. Regular cleaning and disinfection. High-touch surfaces and equipment should be cleaned and disinfected regularly to reduce the risk of cross-contamination. Patient positioning. Positioning Mr. Thompson in an upright or semi-upright position can help prevent aspiration and subsequent pneumonia development. Vaccination strategies. Vaccination against pneumococcal pneumonia and influenza is crucial, especially for at-risk populations like Mr. Thompson. The pneumococcal vaccine PCV can significantly reduce the incidence of pneumonia caused by Streptococcus pneumoniae. Annual influenza vaccination can also prevent viral infections that can lead to secondary bacterial pneumonia. By integrating these infection control measures and vaccination strategies, the hospital can significantly reduce the risk of pneumonia in high-risk patients like Mr. Thompson. Discuss the pathogenesis of Candida albicans infections and the factors that contribute to its opportunistic nature. Include the host factors that predispose individuals to candidiasis. Answer: C. Albicans is a yeast that can cause opportunistic infections, particularly in immunocompromised individuals. The pathogenesis of C. albicans infections involves several factors. Dimorphic nature. C. albicans exists in both yeast and hyphal forms. Ability to switch between these forms allows it to evade host immune responses and invade tissues. The hyphal form is associated with tissue damage and inflammation, adhesion and biofilm formation. C. Albicans can adhere to surfaces and form biofilms on medical devices, such as catheters and prosthetic devices. Biofilms protect the organism from the host immune system and antifungal agents. Enzymatic activity. The production of hydrolytic enzymes, such as proteases and phospholipases, facilitates tissue invasion and damage. These enzymes degrade host tissues and impair immune responses. Immune evasion. C. Albicans can modulate the host immune response by altering its surface antigens and evading detection by immune cells. Host factors contributing to candidiasis: immunocompromised state, individuals with HIV/AIDS, those undergoing chemotherapy, or recipients of organ transplants have reduced immune function, increasing susceptibility. Diabetes mellitus. Hypoglycemia can promote fungal growth and impair immune responses. Antibiotic use. Broad-spectrum antibiotics disrupt normal flora, allowing C. albicans to proliferate unchecked. Moisture and warmth. Areas of the body that are moisty. G. skin folds, oral cavity provide a suitable environment for fungal growth. Understanding these pathogenic mechanisms and host risk factors is crucial for preventing and managing candidiasis. Evaluate the effectiveness of sterilization methods and the importance of proper sterilization in infection control within healthcare settings. Answer: sterilization methods are critical for eliminating all forms of microbial life, including bacteria, viruses, fungi, and spores, to prevent healthcare-associated infections. The primary methods of sterilization include autoclaving, steam sterilization. Uses high-pressure steam at temperatures of 120 UNDEC to 134 DEC for a specified time, typically 1530 minutes. It is effective against all microorganisms and is the gold standard for sterilizing surgical instruments and lab equipment. Ethylene oxide sterilization. A gas used to sterilize heat-sensitive materials. It operates at lower temperatures and requires longer exposure times. ETO is effective against a broad range of microorganisms, but necessitates aeration post-sterilization to remove toxic residues. Chemical sterilization. Agents like hydrogen peroxide vapor and peracetic acid can be used for sterilization, especially for heat-sensitive items. These methods also require specific conditions, e. G. Temperature humidity to ensure effectiveness. Radiation sterilization. Gamma radiation or electron beams can sterilize medical supplies and pharmaceuticals. This method is suitable for items that cannot withstand heat or moisture. Importance of proper sterilization. Infection prevention. Proper sterilization is vital in preventing the transmission of pathogens during medical procedures, thus reducing the risk of postoperative infections. Compliance with regulations. Healthcare facilities must adhere to guidelines set by organizations like the Centers for Disease Control and Prevention (CDC) and the World Health Organization, which mandate effective sterilization protocols. Patient safety. Maintaining a sterile environment is essential for protecting patients, particularly those who are immunocompromised, from infections that could lead to severe complications or death. Overall, understanding and implementing proper sterilization methods are fundamental components of infection control in healthcare settings. Explain the role of antibodies in the immune response, including their structure, function, and the different classes of immunoglobulins. Answer. Antibodies, also known as immunoglobulins, are glycoproteins produced by B cells in response to antigens. They play a crucial role in the immune response through various mechanisms. Structure. Antibodies have a Y-shaped structure composed of two heavy chains and two light chains connected by disulfide bonds. Each antibody has a variable region which binds to specific antigens and a constant region that determines its class and effector function. Functions of antibodies. Neutralization. Antibodies can bind to pathogens or toxins, preventing their interaction with host cells. This neutralization is essential for blocking viral entry into cells. Opsonization. Antibodies enhance phagocytosis by coating pathogens, making them more recognizable to phagocytes like macrophages and neutrophils. Complement activation. The binding of antibodies to antigens can initiate the complement cascade, leading to the lysis of pathogens and enhancing inflammation. Classes of immunoglobulins. The most abundant antibody in serum, providing long-term immunity. It can cross the placenta, providing passive immunity to the fetus. The first antibody produced in response to an infection. It is effective in agglutinating pathogens and activating complement. Found in mucosal areas. G. Saliva, tears, breast milk. It plays a critical role in mucosal immunity by preventing pathogen adherence to epithelial cells. Involved in allergic reactions and protection against parasitic infections. It binds to allergens and triggers histamine release from mast cells. Primarily found on the surface of B cells. Its precise function is less understood but is believed to play a role in B cell activation. The diversity and specificity of antibodies are essential for mounting effective immune responses against a wide array of pathogens. Describe the life cycle of Plasmodium falciparum and the pathophysiological mechanisms that contribute to malaria's symptoms. Answer. Plasmodium falciparum is the causative agent of the most severe form of malaria. Its life cycle involves two hosts, the Anopheles mosquito and humans. Life cycle stages. Sporozoite stage. The cycle begins when an infected female Anopheles mosquito bites a human, injecting sporozoites into the bloodstream. Liver stage. The sporozoites travel to the liver where they invade hepatocytes and undergo asexual reproduction, schizogony, forming merozoites. This stage lasts about 1-2 weeks and is asymptomatic. Blood stage. Merozoites are released into the bloodstream where they invade red blood cell RECS. In RECS, they continue to multiply, eventually leading to cell lysis and the release of new merozoites, perpetuating the cycle. Some merozoites differentiate into gametocytes, which can be taken up by another mosquito during a blood meal. Gametocyte stage. In the mosquito, gametocytes undergo sexual reproduction, forming zygotes that develop into oocysts. These oocysts produce sporozoites that migrate to the mosquito's salivary glands, ready to infect a new host. Pathophysiological mechanisms. Hemolysis. The destruction of BCS leads to anemia, resulting in fatigue, pallor, and increased cardiac output. Cytokine release. Infected BCS trigger the release of pro-inflammatory cytokines, contributing to fever, chills, and systemic inflammation. Sequestration. Falciparum infected BCS can adhere to vascular endothelium sequestration, leading to obstruction of blood flow, hypoxia, and tissue damage, particularly in the brain, cerebral malaria, and organs. Metabolic acidosis. Increased lactate production due to tissue hypoxia can result in metabolic acidosis, further complicating the clinical picture. Understanding the life cycle and pathophysiological mechanisms of Plasmodium falciparum is crucial for developing effective treatments and preventive strategies against malaria. Evaluate the mechanisms of action of common antifungal agents and their relevance in treating systemic fungal infections. Answer: antifungal agents can be classified based on their mechanisms of action, targeting various aspects of fungal biology. Here are some common antifungal agents. Polyene antifungals e.g. amphotericin B. Mechanism: binds to ergosterol in fungal cell membranes, creating pores that lead to leakage of cellular contents and cell death. Clinical relevance: effective against a broad spectrum of fungi including Candida and Aspergillus species. However, it can cause nephrotoxicity, so monitoring renal function is essential. Azoles e.g. fluconazole, itraconazole. Mechanism: inhibit the enzyme lanosterol 14-adimethylase, blocking the conversion of lanosterol to ergosterol, disrupting cell membrane synthesis. Clinical relevance: effective against Candida and some Aspergillus species. They are generally well tolerated but may cause hepatotoxicity and interact with other medications due to their effect on cytochrome P enzymes. Echinocandins e.g. caspofungin, micafungin. Mechanism: inhibit B13 deglucan synthase, disrupting the synthesis of the fungal cell wall. Clinical relevance: particularly effective against Candida and Aspergillus species. They are typically reserved for patients who do not respond to other treatments due to their high cost and infusion-related reactions. Allylamines e.g. terbinafine. Mechanism: inhibit squalene epoxidase, leading to a depletion of ergosterol and accumulation of toxic squalene. Clinical relevance: primarily used for dermatophyte infections but can also be effective against Candida. It is usually well tolerated but can affect liver function. Understanding the mechanisms of action of these antifungal agents is crucial for optimizing treatment strategies against systemic fungal infections and minimizing the risk of resistance. Analyze the impact of herd immunity on vaccination strategies, particularly in the context of controlling outbreaks of infectious diseases such as measles. Answer: herd immunity refers to the protection of a population from infectious disease outbreaks when a significant proportion of individuals are immune either through vaccination or previous infections. The impact of herd immunity on vaccination strategies includes thresholds for herd immunity. Each infectious disease has a specific herd immunity threshold, which is the percentage of the population that needs to be immune to prevent outbreaks. For measles, this threshold is approximately 95%. Vaccination strategies aim to achieve and maintain immunity levels above this threshold. Protection of vulnerable populations. Vaccination not only protects vaccinated individuals, but also those who cannot be vaccinated, e.g. infants, immunocompromised individuals, by reducing the overall incidence of disease in the community. This indirect protection is critical for maintaining public health. Outbreak prevention. High vaccination coverage can prevent outbreaks by limiting the number of susceptible individuals. In contrast, a decline in vaccination rates can lead to increased susceptibility and outbreaks, as seen in recent measles outbreaks in areas with lower vaccination rates. Strategies to increase vaccination rates. Public health initiatives must focus on education, accessibility, and addressing vaccine hesitancy to achieve herd immunity. Strategies include community outreach, school vaccination requirements, and public awareness campaigns about the importance of vaccines. Monitoring and surveillance. Continuous monitoring of vaccination coverage and disease incidence is essential for timely interventions. Health authorities can implement strategies to boost vaccination rates in under-immunized populations, especially during outbreaks. Overall, herd immunity plays a pivotal role in shaping vaccination strategies and controlling infectious disease outbreaks, highlighting the importance of maintaining high vaccination rates in the population. Discuss the role of mitochondria in cellular metabolism. How does mitochondrial dysfunction contribute to the pathophysiology of diseases such as mitochondrial myopathy? Answer: mitochondria are known as the powerhouse of the cell due to their critical role in ATP production through oxidative phosphorylation. They contain their own DNA, TNA, and are involved in several metabolic pathways, including the Krebs cycle and fatty acid oxidation. Mitochondrial dysfunction can lead to decreased ATP production, causing energy deficits in cells, which is particularly detrimental in high-energy demanding tissues like muscle and nervous tissue. In mitochondrial myopathy, mutations in mTNA or nuclear DNA that affect mitochondrial function result in muscle weakness, exercise intolerance, and myalgia. The pathophysiology can include increased reactive oxygen species, ROS production due to defective electron transport chain complexes leading to oxidative stress and further cellular damage. Understanding these mechanisms is essential for recognizing how mitochondrial dysfunction contributes to various diseases, highlighting the importance of mitochondrial health in overall cellular function. Compare and contrast the processes of active transport and facilitated diffusion. Provide examples of molecules that utilize each mechanism. Answer: active transport and facilitated diffusion are two essential mechanisms for the movement of substances across the cell membrane, but they differ fundamentally in their energy requirements and mechanisms. Active transport. This process requires energy, usually in the form of ATP, to move molecules against their concentration gradient from low to high concentration. An example is the sodium-potassium pump NACE, which actively transports 3 No ions out of the cell and 2 K ions into the cell, crucial for maintaining cellular ion balance and membrane potential. Facilitated diffusion. This process does not require energy as it involves the movement of molecules down that concentration gradient from high to low concentration through specific transport proteins. Glucose, for instance, enters cells via the GLUT transporters through facilitated diffusion. Understanding these mechanisms is crucial for grasping how cells maintain homeostasis and transport essential nutrients and ions. Explain the roles of cyclins and cyclin-dependent kinase EDKS in the regulation of the cell cycle. How might dysregulation of these proteins contribute to oncogenesis? Answer: cyclins and CDKS are vital regulators of the cell cycle. Cyclins are proteins whose levels fluctuate throughout the cell cycle, while CDKS are enzymes that, when activated by binding to cyclins, phosphorylate target proteins to drive the cell cycle forward. Cyclin CDK complexes. Different cyclin CDK complexes are active at specific phases of the cell cycle. For example, cyclin DCK6 is crucial for progression through the G phase, while cyclin BCDK is essential for the transition from G to M phase. Dysregulation of these proteins, such as overexpression of cyclins or mutations in EDKS, can lead to uncontrolled cell division, a hallmark of cancer oncogenesis. For instance, the overexpression of cyclin D has been implicated in breast cancer as it accelerates the G phase and promotes cell proliferation. Differentiate between apoptosis and necrosis in terms of their morphological and biochemical characteristics. What are the implications of these differences for tissue homeostasis and pathology? Answer: apoptosis and necrosis are two distinct forms of cell death with significant differences in their mechanisms and consequences. Apoptosis: this is a programmed and controlled process that results in cell death without eliciting an inflammatory response. Morphologically, apoptotic cells exhibit cell shrinkage, chromatin condensation, and the formation of apoptotic bodies. Biochemically, apoptosis involves the activation of caspases and the externalization of phosphatidylserine on the outer leaflet of the membrane. Necrosis: this is an uncontrolled form of cell death, typically resulting from acute cellular injury, leading to cell swelling, membrane rupture, and the release of cellular contents into the extracellular space, which can provoke an inflammatory response. The implications for tissue homeostasis are profound. Apoptosis helps to eliminate damage to unwanted cells without causing inflammation, maintaining tissue integrity, while necrosis can lead to inflammation and further tissue damage, contributing to various pathological conditions such as myocardial infarction or stroke. Mr. Roberts, a 55-year-old man, presents with fatigue and muscle weakness. Upon further examination, laboratory tests reveal elevated serum creatine kinase (CK) levels. A muscle biopsy shows abnormal mitochondria with disrupted Christie. What is the most likely underlying mechanism of his condition, and how might this relate to mitochondrial inheritance patterns? Answer: Mr. Roberts' symptoms, elevated serum CK levels, and the muscle biopsy findings suggest a mitochondrial myopathy, likely due to mitochondrial dysfunction. The disruption of Christie indicates impaired oxidative phosphorylation, leading to decreased ATP production and muscle cell damage. Management considerations. Genetic counseling. Mitochondrial disorders can be maternally inherited due to the exclusive maternal transmission of TNA. Mr. Roberts should consider genetic counseling to understand potential implications for family members. Supportive care. As there is currently no cure for mitochondrial myopathies, management is supportive and may include exercise programs tailored to individual tolerance levels, nutritional support, and possibly the use of supplements like coenzyme Q or L-carnitine, which may help improve energy metabolism. Monitoring. Regular follow-up with neuromuscular specialists is critical to monitor disease progression and manage symptoms effectively. Describe the role of G-protein coupled receptor ERS in cellular signaling. How can dysregulation of GPCR signaling pathways contribute to disease states? Answer: GPCRS are a large family of membrane receptors that play critical roles in cell signaling by responding to various ligands, including hormones, neurotransmitters, and environmental stimuli. Upon ligand binding, GPCRS undergo conformational change, activating associated G proteins, which then initiate intracellular signaling cascades. Signaling pathways. CAM pathway. In the case of the beta-adrenergic receptor, activation leads to the production of CAM, which activates protein kinase (PK) and influences various cellular responses, such as increased heart rate and energy mobilization. Phosphatidylinositol pathway. Activation of certain GPCRS can stimulate phospholipase C, leading to the production of inositol trisphosphate (IP) and diacylglycerol (DAG), resulting in increased intracellular calcium levels and activation of protein kinase C (PAC). Dysregulation implications. Dysregulated GPCR signaling is implicated in various diseases, including heart failure, due to chronic stimulation of beta-adrenergic receptors, cancer, where GPCRS can promote tumorigenesis, and psychiatric disorders linked to serotonin and dopamine receptor signaling. What are the key differences between embryonic stem cells (ESCs) and adult stem cells (ASCs) in terms of differentiation potential and sources? Discuss how these differences impact their therapeutic applications. Answer: embryonic stem cells (ESCs) and adult stem cells (ASCs) differ significantly in their differentiation potential and sources. Embryonic stem cells, derived from the inner cell mass of blastocysts, SCS, are pluripotent, meaning they can differentiate into nearly all cell types of the body. Their ability to proliferate indefinitely in culture makes them an attractive option for regenerative medicine, although ethical concerns regarding their use remain. Adult stem cells. These are multipotent stem cells found in various tissues, e.g. hematopoietic stem cells in bone marrow. ASCS are limited to differentiating into cell types related to their tissue of origin, which restricts their application compared to ESCs. Therapeutic implications. The pluripotency of SCS allows for potential use in a wide range of therapies, including tissue regeneration and transplantation. In contrast, ASCS have more immediate applications in treating blood disorders, e.g. bone marrow transplants and tissue repair. Understanding these differences is critical for developing effective stem cell therapies and navigating ethical considerations. Discuss the role of the endoplasmic reticulum in protein synthesis and post-translational modification. What are the consequences of R stress on cellular homeostasis? Answer: the endoplasmic reticulum is a vital organelle involved in the synthesis, folding, modification, and transport of proteins. The rougher, studded with ribosomes, the roughy, R is primarily responsible for the synthesis of membrane-bound and secretory proteins. Newly synthesized proteins enter the lumen of the R, where they undergo post-translational modifications, such as glycosylation and disulfide bond formation, which are essential for proper protein folding and function. Smoother, involved in lipid synthesis and detoxification processes. The smoothie R also plays a role in calcium storage and metabolism. Consequences of R stress. Under conditions such as excessive protein load, mutations in proteins, or environmental stress, the R may experience stress, leading to a phenomenon known as the unfolded protein response. If the stress is unresolved, prolonged R stress can trigger apoptosis or contribute to diseases like diabetes, neurodegeneration, and cancer, emphasizing the importance of R function in maintaining cellular homeostasis. Explain the significance of cadherins and integrins in cell adhesion and signaling. How does their dysfunction relate to pathological conditions such as cancer metastases? Answer: cadherins and integrins are critical cell adhesion molecules that mediate cellular interactions and signaling. Cadherins. These are calcium-dependent adhesion molecules that facilitate homophilic cell-cell adhesion, playing essential roles in tissue integrity and signaling pathways that regulate cell growth and differentiation. Loss of cadherin function, particularly cadherin in epithelial cells, can lead to increased cell motility and is commonly associated with the epithelial to mesenchymal transition and during cancer progression. Integrins. These are transmembrane receptors that mediate cell extracellular matrix ECM interactions. Integrins transmit signals that influence cellular responses to the ECM, affecting cell survival, proliferation, and migration. Dysfunction and cancer metastases. In cancer, the downregulation of cadherins and the upregulation of integrins can facilitate detachment from the primary tumor, allowing cancer cells to invade surrounding tissues and metastasize. Understanding these mechanisms is crucial for developing therapeutic strategies targeting cell adhesion pathways in cancer treatment. Describe the events and regulatory mechanisms that occur during the G phase of the cell cycle. How does the G checkpoint ensure genomic integrity before DNA replication? Answer: the G phase is the first stage of the interphase in the cell cycle where the cell grows, synthesizes proteins, and prepares for DNA replication. Key events and regulatory mechanisms during G include cell growth. The cell increases in size and synthesizes RNA and proteins required for DNA synthesis. Nutrient sensing. The cell assesses its internal environment, ensuring adequate resources, nutrients, energy are available for division. Regulatory proteins. Cyclins, particularly cyclin D, are synthesized and bind to CEEDK6, activating the G checkpoint. G checkpoint role. The G checkpoint, often referred to as the restriction point, ensures that the cell only proceeds to the S phase if conditions are favorable and the genome is intact. Key proteins involved include P. This tumor suppressor protein is activated in response to DNA damage, leading to cell cycle arrest or apoptosis if damage is irreparable. RB protein. The retinoblastoma protein RB inhibits progression to S phase until phosphorylated by cyclin CDK complexes, ensuring that the cell is ready for DNA replication. Discuss the ethical principle of non-maleficence in the context of patient care. How does it differ from beneficence, and what challenges might a physician face in applying this principle? Answer: non-maleficence, derived from the Latin phrase prima non nocere, means first, do no harm. This principle emphasizes the obligation of healthcare providers to avoid causing harm to patients, whether through actions of commission or omission. In contrast, beneficence refers to the obligation to act in the best interest of the patient, promoting good and providing positive benefit. A physician may face challenges in applying non-maleficence, particularly in scenarios where treatments could have adverse effects. For example, when considering chemotherapy for cancer patients, a physician must weigh the potential benefits against the significant side effects. Guidelines such as the OMA's Code of Medical Ethics underscore the importance of balancing risks and benefits, emphasizing informed consent and shared decision-making to align treatment with the patient's values and preferences. Describe the significance of the DSM-5 in the classification of mental disorders. What are its implications for diagnosis and treatment? Answer: the DSM-5 Diagnostic and Statistical Manual of Mental Disorders, 5th edition, serves as a critical reference for clinicians in diagnosing mental disorders. It provides standardized criteria for classification, which enhances the reliability and validity of diagnoses across different healthcare providers. The implications of the DSM-5 are profound. Accurate classification influences treatment modalities, as different disorders may require specific therapeutic approaches, e.g., cognitive behavioral therapy for anxiety disorders versus pharmacotherapy for severe mood disorders. Moreover, understanding a diagnosis through the DSM-5 can facilitate communication among healthcare professionals and inform insurance coverage decisions. Its use aligns with the ethical principles of beneficence and justice, ensuring patients receive appropriate and equitable care. A 55-year-old male patient presents with fatigue, weight loss, and night sweats. After thorough history and physical examination, which differential diagnosis should be prioritized and what further steps should be taken in the clinical decision-making process? Answer: given the symptoms of fatigue, weight loss, and night sweats, the differential diagnosis should prioritize conditions such as tuberculosis, highly relevant particularly in at-risk populations, lymphoma. Both Hodgkin's and non-Hodgkin's lymphoma could present similarly. Hyperthyroidism can cause significant weight loss and fatigue. Malignancies. Other cancers should also be considered. In the clinical decision-making process, the physician should conduct targeted diagnostic tests, including tuberculin skin test or interferon gamma release assays, to rule out TB, complete blood count, CBC, to assess for anemia or leukopenia. Imaging studies. A chest X-ray could reveal mediastinal or pulmonary pathology. Thyroid function tests to evaluate for hyperthyroidism. These steps will help narrow the differential diagnosis and guide appropriate management strategies. Explain the neurobiological mechanisms underlying addiction. How do these mechanisms relate to withdrawal symptoms and management? Answer: addiction is primarily characterized by alterations in brain reward pathways, particularly involving neurotransmitters like dopamine. Substances of abuse often hijack the brain's natural reward system, leading to increased dopamine release, which reinforces drug-seeking behavior. Withdrawal symptoms arise when a substance is abruptly discontinued as the brain struggles to regain homeostasis. For example, in opioid withdrawal, patients may experience symptoms such as nausea, vomiting, and severe pain due to the abrupt decrease in endogenous endorphin production. Management of withdrawal involves both pharmacological and non-pharmacological strategies. Medications such as methadone or buprenorphine may be used to taper down opioid use gradually. Additionally, supportive care, counseling, and behavioral therapies are critical components of a comprehensive treatment plan aimed at addressing both the physical and psychological aspects of addiction. A 34-year-old female presents with abdominal pain and abnormal liver function tests. What laboratory tests would be essential for a differential diagnosis, and how should their results be interpreted? Answer: in this scenario, a focused workup should include liver function tests (LFTs) to evaluate ALT, AST, alkaline phosphatase, and bilirubin levels. Elevated ALT and AST may suggest hepatocellular injury, while alkaline phosphatase elevation could indicate cholestasis. Hepatitis panel to assess for viral hepatitis, which can lead to abnormal liver function tests. Autoimmune markers. Tests for anti-nuclear antibodies on an anti-smooth muscle antibodies (SMAT) can help identify autoimmune hepatitis. Imaging studies and abdominal ultrasound can help visualize structural abnormalities such as gallstones or liver lesions. Interpreting these results requires understanding the context of the patient's symptoms and the likelihood of different etiologies. For instance, markedly elevated AST and ALT in the context of a history of alcohol use may suggest alcoholic hepatitis, whereas a positive hepatitis panel could confirm viral etiology. In conducting a patient history, what strategies can a physician employ to build rapport and ensure effective communication? Discuss how these strategies can affect the diagnostic process. Answer: building rapport with patients is essential for effective communication and can significantly impact the diagnostic process. Strategies include active listening. This involves giving the patient full attention, nodding, and summarizing their concerns to ensure understanding. Empathy. Expressing understanding and compassion helps patients feel valued and understood, which can encourage openness about their symptoms. Open-ended questions. Asking questions that allow patients to elaborate. E.g., can you tell me more about your pain? Encourages detailed responses and can reveal critical information. Nonverbal communication. Maintaining eye contact and using appropriate body language fosters trust and comfort. These strategies lead to a more comprehensive understanding of the patient's condition, potentially uncovering important aspects of their history that may be missed in a more clinical, detached approach. This aligns with the ethical principle of autonomy, respecting the patient's perspective and involvement in their care. Compare and contrast Erikson's psychosocial development theory with Piaget's cognitive development theory. What implications do these theories have for understanding a child's behavior? Answer: Erikson's psychosocial development theory emphasizes the impact of social interactions and experiences on personality development across 8 stages from infancy to late adulthood. Each stage presents a psychosocial conflict that must be resolved for healthy development, e.g., trust versus mistrust in infancy. In contrast, Piaget's cognitive development theory focuses on how children acquire knowledge through interactions with their environment, characterized by 4 stages: sensoromotor, pre-operational, concrete, operational, and formal operational. Piaget's theory posits that children move through these stages at their own pace, building increasingly complex cognitive structures. Implications for understanding a child's behavior include recognizing that a child's actions may stem from unresolved psychosocial conflicts, Erikson, or their current cognitive capabilities, Piaget. For instance, a child struggling with trust may exhibit anxiety in new social settings, while a child in the pre-operational stage may engage in magical thinking, leading to behaviors that seem irrational to adults. Understanding these frameworks allows clinicians to tailor interventions to support healthy development and address behavioral concerns effectively. Discuss the importance of cancer screening guidelines in preventive care. How do these guidelines vary by age, risk factors, and gender? Answer: cancer screening guidelines play a crucial role in preventive care by promoting early detection of cancers, which can lead to improved survival rates. Different organizations, such as the American Cancer Society ACTS and the United States Preventive Services Task Force USPS, provide recommendations based on extensive research. These guidelines vary by age. For example, mammography for breast cancer is typically recommended starting at age 40 or 50, depending on the guideline. Similarly, colon cancer screening is recommended beginning at age 45 for average-risk individuals. Risk factors: individuals with a family history of certain cancers, e.g., breast or colorectal, may require earlier and more frequent screenings. Gender: guidelines differ for men and women. For instance, prostate-specific antigen assay testing is generally recommended for men starting at age 50 but may begin earlier for those at higher risk. Adhering to these guidelines is vital for reducing cancer morbidity and mortality, ensuring that patients receive appropriate and timely evaluations based on their individual risk profiles. Describe the steps involved in performing a venipuncture. What considerations should be taken into account to ensure patient safety and comfort during the procedure? Answer: performing a venipuncture requires careful adherence to procedural steps to ensure patient safety and comfort. Preparation: gather necessary supplies, e.g. gloves, tourniquet, alcohol swabs, needle, collection tubes. Identify the appropriate vein, typically in the antecubital fossa, e.g. median cubital vein. Patient interaction: explain the procedure to the patient, addressing any concerns to minimize anxiety. Obtain informed consent. Site preparation: apply a tourniquet above the chosen site to engorge the vein. Clean the site with an alcohol swab, allowing it to dry to prevent stinging upon needle insertion. Needle insertion: hold the skin taut and insert the needle at a 1.530 angle. Bevel up. Advance until blood flow is observed. Collection: attach collection tubes and allow them to fill according to the order of draw to prevent cross-contamination. Post-procedure care: remove the tourniquet, withdraw the needle, and apply pressure to the site to minimize bleeding. Bandage the site and provide aftercare instructions. Considerations for patient safety include using proper techniques to minimize infection risk, hand hygiene, wearing gloves, and being aware of the patient's condition, e.g. coagulopathy. Ensuring patient comfort involves being gentle during the procedure and providing emotional support throughout. A 60-year-old male patient presents with an elevated blood glucose level. What laboratory tests should be conducted to confirm a diagnosis of diabetes mellitus, and how should their results be interpreted? Answer: to confirm a diagnosis of diabetes mellitus, the following laboratory tests should be conducted. Fasting plasma glucose (FPG), a fasting blood glucose level of 120 SMVDL 7.0 ml on 2 separate occasions indicates diabetes, or glucose tolerance test op. A 2-hour plasma glucose level of 200 mVDL 11.1 ml during a 75 grams OGTT is diagnostic. Hemoglobin (HbAC), an AC level of 6.5%, 48 mmol also confirms diabetes. This test reflects average blood glucose levels over the past 2-3 months. Interpretation of these results requires contextual understanding. For example, while an elevated FPG confirms diabetes, it is crucial to rule out other conditions, such as stress-induced hypoglycemia, that could temporarily raise glucose levels. Additionally, confirmation of diabetes with repeat testing on a separate day is recommended unless there are unequivocal hypoglycemic symptoms, e.g. polyuria, polydipsia. This aligns with the diagnostic criteria outlined by the American Diabetes Association (ADA).